Alopecia, when hair falls out, causes, types and key clues. Ever wondered why hair suddenly starts falling out, or why some bald patches grow back while others leave permanent scars? Let's understand alopecia in just 3 minutes. First, what is alopecia? Alopecia simply means partial or complete loss of hair, most commonly from the scalp. Hair growth depends on genetic, racial, nutritional and hormonal factors. Hair loss can occur either because the hair follicle is destroyed or dysfunctional, or because the hair shaft breaks. Now, here's the most important classification. Can you guess the 2 major types? Scarring and non-scarring alopecia. In scarring alopecia, the follicle is permanently destroyed and replaced by scar tissue, so hair loss is usually permanent. Causes include discoid lupus erythematosus, lichen planus, inflammatory folliculitis, carrion, scleroderma, trauma, burns and radiation. In non-scarring alopecia, the follicle remains intact, so hair can potentially regrow. Important examples include androgenetic alopecia, Alopecia Areata Telogen Effluvium, traction alopecia, tinea capitis and trichotillomania. Let's quickly understand the high-yield ones. Traction alopecia results from repeated pulling of hair, for example, tight hairstyles, buns, braids or even tight headgear. Trichotillomania is compulsive hair pulling. Look for an irregular patch with broken, twisted hairs pointing in different directions. Now, what happens after severe illness or pregnancy? That's telogen effluvium. It causes diffuse hair loss, typically about 3 months after the triggering event, because many hairs enter the telogen or resting phase simultaneously. The good news? Hair usually regrows within a few months. Next, the classic patchy type, Alopecia areata. It causes sharply defined, smooth patches of hair loss and is immune-mediated. The classic clue? Exclamation-mark hairs at the edge of the bald patch. Narrow near the scalp and wider towards the tip. It can affect the eyebrows, eyelashes and beard too. Extensive disease is called alopecia totalis when the entire scalp is affected, and alopecia universalis when the whole body loses hair. Finally, male pattern baldness, or androgenetic alopecia. It is a gradual, asymptomatic thinning mainly involving the bitemporal region and vertex. It can also occur in women, particularly after menopause. So, here's your quick challenge. A patient develops diffuse hair loss 3 months after a severe illness. Which diagnosis? Telogen effluvium. And the young patient with sharply demarcated bald patches and exclamation-mark hairs. Alopecia areata. Management depends on the cause. Options may include reassurance, topical or intralesional steroids, minoxidil, finasteride in appropriate androgenetic alopecia, hair transplantation and cosmetic camouflage. For evaluation, examine the scalp carefully, including with magnification. And look at the eyebrows and eyelashes. Initial investigations may include full blood count, serum ferritin, total protein, thyroid profile, ANA and testosterone, guided by the clinical picture. And remember the golden rule. Scarring alopecia destroys the follicle, non-scarring alopecia preserves it. That one distinction can make alopecia much easier to remember.